and welcome to my little space on the internet. My name's Kelly and I am a CBT therapist and forensic psychologist. And today I'm going to be talking to you about compassion fatigue. So I'm going to explain what it is, how you can recognise it, and perhaps most importantly, what you can do about it. And so compassion fatigue, it may be a phrase that you're familiar with, or it may be something that you've never heard before, but you're probably going to understand or at least recognise the idea behind it. Simply put, it's a feeling that you have no more empathy left to give. There's no more gas in the tank, so to speak. And previously, the compassion fatigue used to be associated with people in the healthcare profession, so maybe healthcare workers, therapists, psychologists, but also first responders and people in the police, in probation, or in the prison system. However, as the world continues to share with us information or news of suffering from all around the globe, more people probably now more than ever could be at risk of developing compassion fatigue. So with that in mind, I think it's something that is important that we talk about and we can understand. So just to make some distinctions, that compassion fatigue is similar to burnout, and we've often heard about the phrase burnout. But burnout usually stems from having maybe too much work or too many responsibilities. Whereas compassion fatigue comes from actually helping others, and you want to keep helping them, but you're sometimes too overwhelmed from being exposed to the trauma of others, which is known as secondary trauma. Or it could be that it's a continuous exposure to trauma or the suffering of others. And like burnout, compassion fatigue is a process. So by that, it takes time to develop. It's not something that's going to happen overnight. It continues to build slowly to the point where you start not to care about yourself or even other people in your life that you normally do care about. And this is because you overuse your compassion skills with others, people that you're working with, and you don't have that compassion left. So compassion fatigue. So with that in mind, I just want to explain maybe some of the symptoms that people frequently express when they are compassionately fatigued. And it's important to note that the sooner that you notice the signs of compassion fatigue, then the sooner that you can care for yourself, that you can replenish your compassion reserves, and to restore your feelings of empathy. So there's a range of things to look out for. So I'm just going to explain some of the ones I think are quite useful. So sometimes feeling physically, psychologically, or emotionally exhausted. Feeling helpless or hopeless or powerless in situations. And all of these can be in and outside work. Feeling irritable, angry, sad, numb. Maybe a sense of feeling detached or having decreased pleasure in activities that would normally have bring you pleasure. Sometimes ruminating about the suffering of others. Feeling anger towards the events or people that are causing the suffering. Even blaming yourself and having thoughts that you haven't done enough to help the individuals that you are working with or the individuals who are suffering. There can be a decreased sense of personal and professional accomplishment, so feeling that you're not getting anywhere, even imposter syndrome. There could be a change in your worldview, so how you see the world and the people in it. There are sometimes some physical symptoms that could include loss of appetite, difficulties in sleep, sometimes feeling quite nauseous or dizzy, even a lack or a massive change in your sex drive. So with that in mind, there are a lot of different symptoms there. But it's being about mindful of where those symptoms come from for you, if there are no other explanation for it. So if you notice those symptoms and you want to be able to treat or support yourself to be able to work through compassion fatigue, it's important to take those steps because we know that when people have compassion fatigue and they don't do anything about it, it can actually lead to other mental health difficulties such as anxiety, depression, even obsessive compulsive disorder through to substance misuse. So you can see that once you've got that understanding of that's what you're experiencing, then it's really important to do something about it. And it may seem a bit kind of cringy or cliche, but you can't pour from an empty cup, or you can't put your oxygen mask on before you help others with theirs, or you need to put your own oxygen mask on before you help others. And so we need to make sure that we're tending to our own emotional and physical well-being whilst we are providing care or support to others. So with that in mind, here's some of the things and the tips that I think are quite helpful. Find a balance between your professional and personal life, making sure you're taking your annual leave, making sure that you are working the hours that you're meant to be working and not overworking. Following a healthy lifestyle, so making sure you get enough sleep, eating enough nutritious food, getting enough exercise, and engaging in positive social relationships. You may want to avoid information overload, so if you are someone who works with a particular client group, not to spend all your evenings watching programs or reading news about it. Identifying your priorities, so what is your priorities, and engage in activities that can replenish or rejuvenate you, so things that make you feel good. Practicing gratitude, so practicing being in the moment rather than where our head or our thoughts are trying to take us. Understanding that suffering and pain is part of the collective human experience and that you don't always have control over that suffering, even though that's really hard to actually hear and accept. But focus on the areas that you do have control over. So your thoughts and your feelings, rather than having those unrealistic expectations about changing things that may be way beyond your control. I know that one can feel quite difficult. And then if you do need to, seek professional help. Just because you are a professional doesn't mean that you can't get support from other professionals. So I hope that that helps you to think about the importance of looking after yourself, because we can't look after others before we look after ourselves. So as soon as you start to recognise any of the warning signs, think about the things that you can change in your life that could potentially help you and to lessen the impact of compassion fatigue. I hope you found that helpful. Please like and subscribe and check out my other videos. And if there's anything in particular you'd like me to cover, then please drop that in the comments. Thank you.